All right, good evening, everyone, and welcome to ATP Live. And today's ATP Live is special because today's is a spotlight on autism spectrum disorder. On August 2nd of every year is the World Autism Awareness Day. And so today being ATP Live, following that Saturday, we're going to create a lot more awareness on autism spectrum disorder. So if you have any questions on autism, please you can ask in the comment section, whether you're watching me on Facebook, on Instagram, on audio room on Facebook, on YouTube, whichever way you're watching me from. Or for those of you who will listen later to the podcast, just feel free to ask your questions. So welcome everyone. I am Bimi Salaboide. I am a pediatrician and I'm actually a neurodevelopmental pediatrician. So this is actually my field. And so I'm going to be talking a lot about autism spectrum disorder today. And I'm wearing blue. I'm lighting it up blue for autism. All right. So welcome everyone. So welcome everyone. Please share the video. We invite friends and family, and I'm also just going to do that right now. Make sure that everybody can see our live audio on each of the platforms. So feel free to help me also share and make sure everybody can hear, everybody can see. Okay, I can't see my live audio yet. And so those of my moderators on the Facebook, you can just help me to pin it to the featured post. I don't know why I can't see my video. All right. Okay, yeah, I can see myself now. It's taking forever for Facebook to show me. All right, so welcome everybody. Welcome to ATP Live Monday. And today is a special edition because we are talking about autism spectrum disorder. So welcome everybody. If you're watching me on Ask the Pediatrician Facebook group, you can actually drop your questions straight onto under the video because I will see your questions. But if you're watching me from ATP Family or ATP Still a Mom or the FCM Baby Care Facebook group, you will need to get to the page to drop your question if you have a question. If you don't have any question, it is all right for you to just leave it there, and now that's fine. Watch your video. Sorry, my light just went off. Just have to put it back. All right, just a minute. Okay, I think I should just put it down over here. All right. Okay. Okay. Oh, I think that's better. Okay, so if you're watching me on YouTube, Instagram, you can drop your question straight under the video. I will say it straight away. All right, so I'm just sharing it to all our groups and making sure everybody can see and everybody can hear me. And those on live audios where you can drop your questions and comments. And I hope you can hear me well. Just let me know if you can hear me, if you can see me. Let me be sure everybody is on the same page with me. Okay. Just a few more shares, then I'll be done. Okay. All right. I'm just sharing the videos to all the various places where the video needs to be. And then we'll be fine to start. But while I'm sharing, please start dropping your questions so that I can answer them as soon as I can. So, but remember that today today is a special spotlight on autism. So I will really, really appreciate if we can try and keep the questions on autism kind of questions preferably. We'll always have time to do all the open house where you can ask any question you have. But let's talk a lot more about autism today. I saw a lot of posts online, and I see a lot of ignorance and misunderstanding of what autism is. So it's like many people don't really understand autism, and many people tend to confuse autism with so many other developmental disorders. So that's why it's important that we talk about autism spectrum disorder. Okay, just give me a few more minutes and then I'll be able to. I think I'm almost done with all the sharing. Okay, and I see how the group. Okay. Okay, can't find my last group share. All right, let me just go back to groups. Okay. Always take me forever to find my video in Ask the Pediatricians. Oh, finally, I've seen it. All right, so I guess I'm done with all the sharing, and I hope everybody can hear me and they can see me, and you have your questions ready. All right, so let's start. Let me go back to StreamYard. All right, let's go to comments. So let's talk about autism first. I will start by talking about autism. So before we start answering the questions, I just want to talk about autism itself. What we call autism spectrum disorder, that is actually the real name. And because autism spectrum disorder is a group of conditions that are characterized by certain things. So there are lots of developmental disorders, and I know sometimes they all seem to run into each other, and sometimes people can kind of get confused. But there are ways by which we differentiate them. So for each of those disorders, even though they may all present or appears to look the same, there are certain things that you will only see in a particular disorder for you to say, oh, yes, it is this disorder. Okay, on and not that particular one. As long as those ones are not there, even though it may look like this feature is present in both, but there are certain things you must see in one before you will now say, okay, this is a this particular disorder. So in autism, it's basically a disorder in which there are problems with social interaction. So people, both children, adults, can have autism, have difficulties with social interaction. Then they have what we call repetitive behavior. So there's social interaction deficit, there's repetitive behavior, and sometimes they also have repetitive speech, and then they also have challenges with what we call non-verbal communication. So basically, autism needs to have those things. If they are not present, if there's no problem with what we call social communication, social reciprocity, and there are no issues with repetitive or restricted kind of behavior, then we cannot say it's autism. Okay, so those are the two major distinguishing features we see in those who have autism. And autism is a neurodevelopmental disorder. In other words, it's something that starts in childhood. So you don't get to become an adult and now develop autism. If you're going to have autism, you must have had it right from the symptoms must have been present from when you are a child. Even though some people don't get their autism diagnosis till they're about maybe even adults, but if you look back, the symptoms or the features must have been present in childhood. And indeed, most children get their autism diagnosis from the age of between 2 and 3. That is when we tend to get autism diagnosis, though the features of autism can be present right from infancy before the age of 1 year. So that is the very important thing to also know about autism. Now, when people talk about autism, what are the features? What are the telltale signs? That's what parents want to ask. Like, what are those things that you will see that will make you to start thinking of autism. So, and like I said, this thing can start even from infancy. Infants are children below the age of 1 year. So, from 6 months, if a child is not having what we call social smile, when children are babies at that age, they start to babble, and they pretend, they do as if they're having conversation with you, even though they don't have that word. But you smile to them, they smile back at you. You behave as if you're talking to them, and they actually talk back in their own baby language. That reciprocity, looking at you, eye contact, those are what we expect at 6 months. So if a child is not having that, it could be one of the red flag for autism spectrum disorder. Also, at some point, some children don't even babble at all, or they don't point. Usually by the age of 1 year, you expect children to start pointing. Usually children may not have much words at that age, but they compensate by pointing. So they want something, they point with their index finger, or they show you when they've done something, they bring it to you, they want to show you, look at what I've done. Children like to show off a lot, or they wave, waving goodbye, showing around 10 months, so, or when you call their name, the tone, or they give some sign of response that you're to their names. So if you are not seeing those signs in a 1 year old, if 1 year old is not pointing, it's not responding to their name, they are not showing, they are not reaching for things, those are also red flags. Then usually by the time they're about 16 months to 2 years, they should begin to have a lot of words. At least they should be able to say single words, combining single to two words together. So if a child is not having any words at all, it may just be speech delay, but sometimes it could also be a feature of autism. But like I said, a child who has speech delay, or who has maybe deafness and all that, they will still be pointing, they will still be looking at you, they will still have the eye contact, they will still respond to their name, but you know that, okay, they don't just have the words. But children with autism will not have the words, and they will not compensate as well with pointing, they will not be showing, they will not be doing all those things. They always want to be on their own. They don't want to play with other children. They want to kind of be isolated. Or you may also begin to see features of repetitive behaviors. Then these are red flags for autism spectrum disorder. Okay, so but at any age, as the children gets older, one of a big red flag for autism is a child who was doing certain things before, maybe saying some words before, and then suddenly stop. So then the child stops saying the words, or it now gets to the point where they don't have any words at all. So we call it regression of skills. So when children lose skills, especially verbal skills, it's a very big red flag for autism spectrum disorder. So you see parents say, oh, the child was talking before, was doing this before, it's fine. Well, then all of a sudden, everything just goes silent, and they can't really figure out what the child can do. The child is not doing any of those things again. The child is not saying any of those words again. Some children start doing that around the age of 18 months or 2 years. So they were saying things before 1 year, around 1 year, then maybe they reach 18 months or 14 months or 2 years, and they stop. It could be one of the red flag of autism spectrum disorder. Children who were babbling before they stop, babbling, or children who avoid, they don't want to look at you. If you find yourself always having to tell the child, look at me when you are calling them or talking to them, that means they don't really have eye contact. And that also is one of the red flag of autism. Or they just prefer to be on their own. They just want to be in their own little world, in their own little bubble or corner. Is also one of the features. Sometimes they have difficulty understanding. So somebody is hurt and is crying, maybe their sibling, an average child will go and tell them sorry and all that. But children with autism may just not do that, or they may even laugh. They may even find it funny that somebody has been hurt, and they don't understand people's feeling emotions. So these are some of the features we also see for people on the autism. Of course, we'll talk about language today, but the next part is the repetitive behavior. So children on the autism tend to have a lot of repetitive behavior. They may repeat words. Sometimes parents confuses this with speech. So they say, oh, this child is always saying what he hears on the TV and all that. For us, that is not speech. That is what we call echolalia. So if the child, if you say, how are you? Instead of the child to say, fine, the child goes, how are you? You say, what is your name? The child goes back, what is your name? So some parents say, oh, you're talking, you can say, what is your name? But that child is only repeating what the child has heard. Or the child can repeat everything he or she has heard on the TV, word for word, or what they, but the child will not use his or her own word to request. So that same child will not be able to say, I want biscuits or I want something. So that is not speech, that is echolalia. And we see that a lot on children of the autism. And sometimes children of the autism also have resistance to change. So they always like things to be done the same way. So they always want to eat maybe the same place. They always want to go the same way when you are following a particular path. I have some of my children that they must only eat a particular brand of maybe McDonald's. And in fact, there's ones I will only eat from only one particular McDonald's shop. And there's no other thing you can do. You cook it another way, go and buy the McDonald's paper and wrap it inside another. The child will still know. They are just very particular about it. Some children have some ritual. They always have to count things. So they must count everything, they have to do things in a way, and they'll do it over and over again. Or they have this fixation with certain things. They always want to do certain things, they want to play with maybe some children want to watch only a particular movie all the time, and they can watch it 100 times. Some children not only watch a particular movie, they only want to watch a particular part of that movie, maybe the intro part. Once they watch the intro part, that's it. Or some children, like even the Peppa Pig, they only want to watch a particular episode, and that's the only episode they watch over and over again. So they have that restricted or peculiar interest. Some of them have rituals. Some of them you must always tell them I love you. Whenever they say something, you must repeat it to them, or not to repeat it to them, they are not going to move forward. So those are features we can get in children on the autism spectrum. And some of them also have what we call sensory sensitivity. So some children have they are particular about the sound. They block their head to certain sound. They can't stand certain sound, like maybe the hand dryer, the blender, all those kind of things. Some children is the food. They can only eat certain food. The texture. Some children cannot eat anything that has like liquid kind of food. It has to be dry, plain kind of food. So they tend to eat lots of maybe pastas, or they will not eat anything that is that is wet or anything like that. And some children have issues with the they want to put everything in their mouth, biting toys and all that. Some children also have issues. They're always moving, running up and down, jumping up and down. They cannot just stay still. And so they have a lot of erratic behavior, like flapping, rocking. They spin around in circle. You would think they will get dizzy. They just keep spinning forever. So those are all red flags or features that we see in children on the autism. Now, let me just sound the notes of warning at the beginning that there's no one feature of everything I've said that will make a child to be autistic. So the fact that a child does not have eye contact, or a child does not respond to their name on its own, does not make that child autistic, does not mean the child has autism spectrum disorder. And that is why only professionals can diagnose autism, because one feature, any child can do any of those things. That doesn't make them to have autism. The child needs to have many of them, and there's a way we group them. So we have what we call diagnostic criteria. So the child must have certain number of this, must tick certain number of boxes here, and must also tick certain number of boxes under the B part. So for us to say the child has a diagnosis, so the child doesn't have eye contact does not mean the child has autism. And the converse is also true. The fact that a child, because this is really for my colleagues, professional doctors, ex-professionals, the fact that a child has eye contact does not mean the child may not have autism spectrum disorder. The fact that a child is talking does not mean the child cannot have autism. So there are people that have autism that can talk. So we need to really understand that the absence of any of those features as well does not mean the child can never have autism. So I've seen people say, the child is having high contact, then it can never be autism. That is not true. There are people that have autism that have high contact, but they have other things. So there must be other things. So there's a number of those criteria they must have, and autism is also pervasive. In other words, it must be present in different settings. So it is not only at home. So some parents will say, my child does not talk at school, but we talk at home and all that. That does not necessarily mean the child has autism. So for a child to be diagnosed with autism, those behavior, those features we have talked about must be present when the child is at home, must be present when the child is in school, must be present when the child comes to the developmental clinic to see the pediatrician. So we must see it. So we always ask the teachers, what do you see? We always ask the parents, what do you see? Then we also look ourselves. So if all of us are seeing the same thing, then it is so easy for us. So for some children, it's so easy to diagnose autism. Even the parent can make the diagnosis of autism. But for some children, you need a professional, because it's a spectrum. So when we say something is a spectrum, It means it ranges from mild. So some people are so mild, you are not sure whether they are autistic or they are just being quiet, not very sociable kind of people. Also, the very, very obviously very severe autistic child who is non-verbal, whom everybody can actually make a diagnosis of autism just because they've read about autism in them. It's a huge spectrum, and we always say that no two children with autism are the same. So every single child on the autism spectrum is different. Every single adult on autism is different from another child. So if you have met somebody with autism, you have met just one person with autism. So you cannot generalize because of what you met in one person. The next person with autism that you're going to meet may be different. So, but those core features, the difficulty with social interaction, social communication, the repetitive or restricted pattern of behavior will be present. They will always be present for us to make a diagnosis of autism spectrum disorder. So that is the first thing I really want to say. Number two is the fact that we don't know the cause of autism. Okay, so a lot of parents were asking me over the weekend, oh, how can we prevent autism in pregnancy? How can we do this? How can we do that? We actually don't know why people have autism. I know, but we know that there are risk factors for autism. So, for example, we know that autism runs in families, so there must be something genetic. So, you see some people, they have, all the boys have autism. So we actually know some genetic condition, and when people have those genetic conditions, they tend to have autism. So things like Fragile X, things like Rett syndrome. If you have those genetic conditions, one of the features you can have is autism. We also know that people that like environmental factors could be play a part. For example, children that are exposed to alcohol when they were in their mother's womb, they have fetal alcohol syndrome, which is why we say pregnant women should not drink alcohol. They can actually present with features that look like autism spectrum disorder. So there's a interplay of both genetic factors and environmental factors when it comes to autism. But strictly speaking, we don't really know why A, we have autism, and B, we not have autism. And we think that we're actually getting more cases of autism. We're not sure whether it's because people are now more aware, and we are now getting to diagnose autism better. Actually, we actually changed the way we diagnose autism a lot. I will not bore you with all those technical jargons, but so it's either because we are now better at making the diagnosis of autism, or people are now more aware of what is autism, because people will just lump everybody together under intellectual disability, and they won't be able to separate it. But I think we are now better at doing that, or people are coming more. People don't hide again. When people have disability, they come out, we want an assessment. So whatever is happening, we seem to be the incidence of autism seem to be going higher and higher. So in US, when I started my pediatrics training, we used to say 1 in 110 children will have autism. Now I'm a developmental pediatrician, and as at now, we say 1 in 44 children in the United States have autism. In Nigeria, obviously, we don't have our figures, but we know we're also seeing a lot of families who are coming down with autism, but we don't know why. And the truth of the matter is that some people with mild autism may not even be diagnosed, but you just notice that they are peculiar the way they do their things, but they're living a normal life. But those who are children who are really towards the moderate to severe ends, those are the ones that we tend to see a lot and tend to have their diagnosis, especially in places like Africa, where we have very limited facilities for assessment and diagnosis of children on the autism spectrum. So then, third thing I want to say is that autism doesn't have a cure. It doesn't have a drug. I know a lot of parents will ask me, okay, so what can I take and that will make it go away? Unfortunately, there's something like that. So let me just quickly say that autism is also a lifelong diagnosis. So in other words, once we give you a diagnosis of autism, we're not going to take it back. We are not going to take it back. So you have it, that's it. But the truth of the matter is that you obviously, as you get older, as you grow, you can acquire more skills, and people can actually learn to live with autism and live a fulfilled life and do everything else everybody else is doing. So sometimes people with autism generally struggle with social interaction, but they can learn to overcome that. And so sometimes people actually wonder whether the children actually have autism or whether the adults actually have autism, because they've learned to overcome some of the difficulties. But intrinsically they will still always have those difficulties, but they just have learned to manage it or handle it. So we usually will not take back the diagnosis of autism. Once we give it, we're giving it for life. And then, but people with autism can learn to overcome they can learn those skills. Those skills that come naturally to people, like social interaction and all those things. People on the autism spectrum, we have to be taught how to do some of those things, but they can definitely learn it and they can live normal, independent. And there are a lot of successful people, professors, captains of industries that are actually on the autism spectrum, and lecturers, all of them that are have autism and they are living normal life. Of course, it's a spectrum. And so what will determine whether what we call prognosis or whether how the child will do in future depends on whether the child just has autism alone or there are other what we call comorbid disorders. So some people cannot just have autism alone, and some children with autism alone are actually they have what we call high functioning autism. They are very intelligent. In fact, they are super intelligent. Some of them have photographic memories. They have skills that other people will never be able to understand how they're able to do that. So they can see something and they can draw it in 2 seconds. I mean, it's just some people are just so fantastic like that. But that is one group of children with autism or adults with autism. But there are other children who have autism who have what we call intellectual disability. So those children, in addition to the autism, they have developmental, they will be slow, they will have difficulty with learning. Some of them may never talk, they will be non-verbal. So those kind of children will need a lot more support. And even into adulthood, they will see need people supporting them compared to a child who has autism but is super intelligent and has normal intelligence. Those ones will end up, living normal life. But there are other things, some children may have ADHD, some children may have some other developmental issues. And those are the things that will actually make the difference between one person with autism and another person with autism. So we don't have a treatment, we don't have a cure for autism, but we can manage autism. So basically what we do is to provide therapy support, so for example, if a child is not speaking, that speech delay, speech therapy will help. Children that have sensory difficulties, they are hyper, they have this sensory hypersensitivity or hypersensitivity to certain things. Occupational therapists will help. Behavior therapists are available to help children, with behavior management. So we teach them how to keep eye contact. We teach them how to respond to their name. We teach them everything. Of course, for children that has learning difficulties, they will need special education teachers and all that. So there are lots of people that support people on the autism spectrum. I also forgot to mention that the assessment for children on the autism spectrum is multidisciplinary. So we know that there are lots of professionals involved in that assessment as well. So the same, most of the time, there are pediatricians there, and of course, psychologists are sometimes involved. You have your speech therapist involved, and those are the core professionals involved in autism assessment. And in terms of therapies as well, all those professionals are also involved. So that is just summary of autism. But the most important final thing I would like to say before I start to answer your questions is the fact that early diagnosis, early intervention works. We actually want to diagnose autism early, and we want to start intervening early because research has proven that when we make those diagnoses before the age of 2 to 3, and we give the children a lot of support, by the time they're about 5 years old, they have made a lot of progress, and it always helps them compared to when we're making diagnosis later, when they've already struggled through childhood and all of that. So we want to make diagnosis of autism early, and we have what we call, there are a lot of screening tools. Ideally, in fact, the American Academy of Pediatrics recommends that all children should be screened for autism. By the time they're about 2 years or 2.5 years, they should have been screened for autism. But even in America, that doesn't happen. So, but if you really worry, but what I adopt is a case-by-case approach. If you are worried that your child may have autism, you can actually go and do a screening test, like we call that MCHAT, modified checklist for autism in toddlers. If you just go online and type modified checklist for autism in toddlers, I think it's available on Autism Speaks website. It's available. You just answer a few questions, I think about 21 questions, it's a true or false. It's a yes or no kind of question, and then it will give you a score. And if the score is either low, less than 2, we're not worried. Between 3 and 8, 3 to 7, it's a moderate risk. It means that we should repeat the M chart again. We should do what we call a follow-up one. And more than 8 ticks means there's significant risk here, and that child should have an autism assessment. Now, if you're living outside Nigeria and all those places, everybody know what to do. So everybody will see a pediatrician, you'll be referred for the autism assessment. So they have their pathway for doing all those assessments. However, I know that it's not always like that in Nigeria, but I would just want to recommend that you should see a pediatrician. And preferably, you need to see a developmental pediatrician, or in some places, pediatric neurologist. In some places, the child psychiatrist or child and adolescent mental health psychiatrist. Some places, psychologists. All of these professionals, we need to do better in terms of our multidisciplinary assessments in Nigeria, but all these professionals can do autism assessment, and then they can provide the right support. It's so important that you see the right professionals, because one of the things I was also coming across is some people say, oh, we've been to ENT and all that. ENT has no business doing autism assessment. The ENT doesn't even do hearing assessment. The people that should be doing hearing assessments are called audiologists. We always require all the children that we are worried about autism to do hearing assessment, because sometimes deafness, the fact that the child cannot hear, can make them look as if they are autistic, but they just can't hear. So we have to be sure first that the child can hear. Once we are sure the child can hear, then we know, okay, let's now do the autism assessment proper. Finally, be wary of people giving your children labels who have not done an assessment. So I see a lot of parents being told their children have this and their children have that, and nobody has done any assessment. Those kind of diagnoses are not given by, I look at your child and I give you, oh, it's a cerebral palsy, oh, it's autism. No, and I see a lot of professionals mixing up those diagnoses. So they will tell, oh, it's autism, or it's cerebral. So the other day I was asking question on another Facebook group for special needs parents, and a lot of parents whose children actually have cerebral palsy are thinking whether their children have autism, and they are kind of confused. And I don't blame the parent, because obviously we professionals, one professional may have told them that, and I'm just trying to tell them, no, a professional needs to do an assessment before they can give a diagnosis, and it is not even every professional that can do those kind of assessments. So they need to know that they need to refer you to the right professionals who are skilled in doing those assessments before they can give a diagnosis. And actually, when they give a diagnosis, we'll also tell you how the child will be managed. So I think that's just a summary of what I want to say about autism spectrum disorder. And now I'm going to go and answer all the questions that you guys have. Okay, I think I should just start on Instagram, as I always like to start on Instagram. Okay, let's go down. Let's go. Okay, so the first question, Tonya Code said, good evening, doctor. Thank you for all you do. Thank you, Tonya. Thank you for joining me. The second question said, Doc, my 1-month-old baby suck around the clock, doesn't sleep during the day. If you sleep, she wakes up, is staring me. This Tonya, do you have a new baby? Because I know you've always been on this Facebook, on this Instagram. Okay, I just want to really answer question on autism today. And if your baby is not if your baby is sucking and not sleeping, then there's something wrong. Maybe your baby is not probably sucking well. Your baby should not suck around the clock. So your baby should suck for 10 to 20 minutes. When they are full, they should be able to sleep 3 to 4 hours. So if your baby is sucking around the clock, check your attachment of the baby to the breast first, and make sure that is being done properly. Okay. So Tonya Code is saying, how do you know a child is autistic? Yes. So how do you know a child is autistic? I think you asked that question before I finished my initial presentation. So Tonya, do you now know how to know now? So basically, you can only suspect. You can only have what we call concerns about autism. And like I said, I've given you some of those features. So if you see a child who is not talking, who is not interacting with other children, who is always isolated, who is doing repetitive behavior, who is doing some peculiar way of doing things, those you may suspect that child is on the autism spectrum. So it is now my job, and that of my colleagues, to make an assessment. So we have to do an assessment, and when we do our assessment, I just jump over that. We ask lots of questions. We ask questions. We do what we call developmental history. We ask a lot of questions, in-depth questions about those autistic diagnostic criteria for autism. We ask lots of questions. Then we also observe the child. We observe the child in the clinic with us. We also ask the teachers to observe the child. Sometimes we actually go to the school to do an observation, because the child must be behaving the same way, not only at school, not only in the clinic, but also at home. So we look at that, and then we look at all our criteria. Is the child ticking all those DSM-5 criteria, or is it ICD level? If the child is taking all the criteria, then we are convinced, yes. Autism diagnosis is not a blood test diagnosis. It's not like a brain scan. It is a clinical developmental diagnosis. So we have criteria that we're looking out for. And once we confirm, we can get that criteria from the information provided by parents, from our observation, then we can give a diagnosis. So that is how we diagnose children on the autism spectrum. And it's a spectrum, so definitely you will always not know all the you will not always be sure yourself. So sometimes we have to even do for the professional, we need to do what we call autism specific observation. So we do things like what we call ADOS. We actually simulate situations, or we play with the children, but we do it in a way that we are looking out whether the child will show us those signs of autism during that, and then we score the children, and sometimes we have to score them and see whether they actually, in addition to our clinical observation, the scoring, everything is enough for us to be convinced to give a diagnosis. Okay, so Tonya is saying, what are the symptoms of autism? I think I've answered that. Okay, I think I've answered your question now. If you have not, please feel free to ask. Nifemi saying, my 20-month-old can only say a few words, 10 words, and most time he forgot the old words he has learned. He stopped using them. Okay, so for Nifemi, I would definitely be worried about a child who was using certain words before and is forgetting them. We call it regression, and that is also one of the red flags of autism. So I would recommend that you take your child to see a developmental pediatrician for further assessment. All right. Let me go on. Okay, I think I've answered that. The next question before I go to Facebook. Okay, I think have I finished all the Instagram questions? Okay, yeah. The next question, if I may. Okay, no. Okay. Mentor Mama say, we are done with EBF. I'm trying to give baby formula, but it's refusing. So Mentor Mama, if you are done with EBF, the next thing is not formula. The next thing is complementary feeding. You should keep on breastfeeding. Being done with EBF doesn't mean you stop breastfeeding. You should still keep breastfeeding your baby, but you are now going to start adding other food, solid food, and that's what we call complementary feeding. So you need to go and listen to any of my podcasts on complementary feeding, or go to our Facebook group and do the complementary feeding guide. You really need that information, because obviously you don't really know what complementary feeding is by your question alone. So you need to go to our Facebook group, or check out my podcast on complementary, or check out our YouTube videos. I have a lot of teachings on complementary feeding. You need to go through that first, and then you will understand how to go with the next thing. All right. Okay, so let me go back to it's Facebook now. Somebody said my baby has rashes on her body. What could that be? If I can't see a rash, I wouldn't know what is the rash is. So, and I don't always take mother's word for it. People always say everything is itch rash. Everything is not itch rashes. So it's best to post that picture on our Facebook group, and we can have a look at it, and we can advise you. Okay. All right. So something is saying, how far are we in Nigeria in taking care of ASD? In Nigeria, we're still far away. We're still a long distance. But I think a lot more is being done in the private sector now in terms of assessment and management of children on the autism spectrum. They saw that Uh, However, it's something we need our government to stand up for, because many people cannot afford those private assessments. They are so expensive, and I really look forward. So in some of our teaching hospitals, you can actually have assessment done. I know we do in Lutz when I was there, and I think some of my colleagues are still doing it. I know they do in Lassus. I know they do in UCH. So if you are not sure where to go for your assessment, go to any of the teaching hospital, ask for the pediatric neurologist or the developmental pediatrician if they have, and they can do your assessment for you. Then therapy is another thing else, but again, a lot's being done in the private sector, and we look forward to the government of Nigeria actually waking up to that responsibility. Okay, lots of people are asking me what are the signs of autism. So if you are late to my presentation, you need to just watch the video all over again so that you can get that part. I've talked about the signs of autism and I've told you what to do. But if you have already gotten your answer, just let me know you've gotten your answer. Somebody is asking about 5 months with eye discharge and all that. What can be applied to the eyes? But you went to the health center, you should have asked that question at the health center. So when you take your child to the hospital, they give you a treatment, you must, any other question you have, you must ask before you leave. Don't be afraid to ask them. Ask them, what do I do with the eyes? So that they will treat it at the same time. If you're not satisfied, then you need to go to an hospital where you know they can treat your child properly. So, and I'll recommend that you either go back, or if you're not sure, if there's no doctor in the health center, please go to the next level, either a general hospital or a standard private. It's better that way. All right, somebody say my 11-month-old have not started crawling. Okay. You can start. So some children never crawl. So that is not some, we don't worry about crawling, because some children will never crawl. They just go from sitting to standing and walking. So some children never crawl. So we're not going to worry about that. I mean, just the one of those who never will crawl. All right, next person, 1-year-old has boils in his hand. He has taken augmentin. Is still growing all over his body. Then you need to go back. So if you've taken your child to the hospital, a doctor has treated the child is not better, you need to go back to the hospital, because it may not be boil, it may be something else. Because if it's a boil and it's already been given antibiotics, then the child should get better. So if the child is not getting better, it may be something else, and you need to go back to your doctors for a follow-up. Okay, so Elizabeth is saying, can we say children with Down syndrome also have autism? Now, this is a very good question, which is bothering me a lot. It's bothering me a lot because I see that people don't understand the difference between the different developmental disorders. So Down syndrome is not autism. Down syndrome is a different diagnosis on its own. It's a condition which is a genetic kind of condition. So children with Down syndrome are born with extra chromosome 21. So for those who have forgotten biology, all of us have chromosomes. That's our genetic makeup, and we all have 23 pairs of those chromosomes. So they are labeled chromosome 1 to 23, and we also have the X and the Y. So now, children with Down syndrome, instead of them having two, I'm trying to make it as simple as possible. I know it's a little more complex for those who are medical people. For children who are chromosome 21, instead of having two, they tend to have three of them. And that is what they call. So, and they have certain peculiar features, the way they look and all that. And they'll also be developmentally delayed and all that, but it is not autism. Okay, it is not autism. So I've told you what autism is and told you what Down syndrome is separately. However, it is possible for a child who has Down syndrome to also have autism. So sometimes that is actually where the confusion comes in, because some of those conditions can coexist. So it's possible for a child who has Down syndrome to have autism. It's possible, just like any other child. It's also possible for a child who has cerebral palsy, for example, to also have autism. But please, these conditions are not the same. And so what I'll recommend is that I was trying to say recently on another Facebook group, please don't label children. You are not to be the one to label children. Don't say a child has this, a child has that. Don't do it. Even as a parent, don't label your child, because a lot of parents ask me questions, my child has this, And then you ask a lot more questions and you realize that they're actually misleading you. Okay, there was a mom that was on a particular Facebook group, and she was even making lots of noise about a particular chromosome condition, that her child has a particular chromosomal condition, blah blah blah. She was even doing a lot of education, and I looked at her child and I immediately felt that that child doesn't even have that condition, because there are features you see in the child. So I asked her one on one, how did you know this child has this? Which doctor told you this? Did they do this particular test? Did they do that particular test? She said, no, they didn't do this. They didn't do this. How did they make those diagnoses? They can never make those diagnoses without doing a karyotype. There is no way they are going to do that. So she was just thinking the child has that diagnosis, and the child, I don't think the child has diagnosis, because I told her you have to go for this particular genetic test before you can make a claim that your child has this particular diagnosis. So, for example, for Down syndrome, a child must have a karyotype. But luckily for us, Down syndrome has their own way, the way they look and all that. I know we're supposed to talk about Down syndrome about a couple of weeks ago, which I'll see too. So they're different. So autism is different. Cerebral palsy is different. Intellectual disability is different. Dyslexia is different. They're all different conditions. They can actually coexist, but most of the time they don't. So a child does not have the two together. So avoid labeling children yourself. Avoid taking label from people who are not qualified to make those diagnoses, and that includes your general doctors, that includes your medical officers, that includes some pediatricians, because it is not everybody who can make those diagnoses, because you have to do a proper assessment before you can say this child has Down syndrome, or this child has autism, or this child has cerebral palsy, or this child has intellectual disability. There are like several developmental disorders, and they are different. Unfortunately or fortunately, they can also coexist. But there's a way we make those diagnoses, and we have to make sure it's the right diagnosis. Because wrong diagnosis leads to wrong approach, wrong expectation, and at the end of the day, frustration. So it's very important that you get the right assessment and the right diagnosis. I know where a lot of parents are fond of doing that in Nigeria. We just borrow a label for the children. Please, let's stop that. It's better you say you don't know what is wrong. Oh, you might just describe what your child is able to do or not able to do, and let the doctors be the ones to say, okay, yes, this is it or this is that. But let's avoid wrongful labels. Okay, the next question from Iberosi say, can a child likes watching TV always? He will never remove his eyes from the TV except he's hungry. He hardly make eye contact. He doesn't laugh for long. Can he be autistic? These are red flags for autism. A child is obsessed with television. He only wants to do TV. The child has no eye contact and all that. So these are red flags for autism. The child needs to have an autism assessment to be given an autism diagnosis. So let me assure you that none of these features alone means the child has autism. So that's why when people say, it doesn't mean the child is autistic, I won't say the child is autistic. I'm only saying your child has flags, red flags, features that worries me about autism. So if I see features that worry me about autism, then I need to do an autism assessment. So sometimes we assess children for autism that have the red flags and they still don't have autism diagnosis, because they need to meet the criteria. They need to meet those diagnostic criteria. So we need to check whether or this child is just maybe poorly parented. The child needs to get over the behavior of being allowed to be on the TV all the time. So that is why we do an assessment. So when we do assessment, then we're sure, okay, this is it. Then we ask the school, is the child doing this, the child doing that? So we do all those assessments before we can say the child has autism. But obviously your child is showing features, but there will be other things as well. So it won't just be fact that the child doesn't have eye contact, the child is attached to receive. There will be other features that we're going to see during the assessment before us to make a diagnosis. I hope that's helpful, Chiamaka. But you should send that child for an assessment. All right. Thank you, Chizaba. Thank you, Facebook user. How can one differentiate between cerebral palsy and autism? Good. Now I can see a lot because I've already suspected this is one of the major challenges parents have. So cerebral palsy main feature. So like I was saying to tell us, so each of those developmental disability or disorder, they have their own distinguishing characteristic, that there are things you must see before you can even say, yes, this is a diagnosis here. Every other thing else is secondary. Okay, so for somebody to have cerebral palsy, they must have difficulties with their movements and their posture. So children on cerebral palsy must have those ones. So if they don't have problem with walking, with movement, with posture, it can never be cerebral palsy. And it must have an insult to the brain. There must be an injury to the brain, and it must manifest with difficulties with posture and movement before we can use the cerebral palsy. Children with cerebral palsy may also be slow talking. They can even have behavior issues and all that. But one thing that you always see with them is the fact that they have motor difficulties. So they may not walk on time. They may be they will be stiff, or like it can be all the legs and all the arms. It can be just one side hemiplegia. It can be just the two legs that are stiff and all that. But there'll be something about movements and posture in cerebral palsy. They may have developmental delay. They may have every other issues, which is where the issues come. Because most of these children with all these developmental disorder, whether Down syndrome, cerebral palsy, autism, they all tend to have developmental delay. So to the parents, the children are always slow doing certain things. So they are slow walking, slow talking, slow doing this. But it is the developmental pediatrician that will now know that, okay, this particular child slow talking, slow walking is Down syndrome. This particular child slow walking, slow talking is cerebral palsy. This particular child slow talking is autism. Children with autism generally will not be slow walking. They will walk normally. They will do every other thing normally. It's just that social interaction. And some of them actually talk normally as well. It's just that they don't have social interaction and they are slow and they have all those repetitive behavior. So sometimes it takes the professional to know which is which. But to the parents or to every other person, you just see a child who is slow in either one or two or three or four parts areas of their development. But for us, it is about not just that they are slow. What is causing this slowness? What is the underlying diagnosis here? And that is why that assessment comes in. So if your child is not having difficulty walking, your child does not have any stiffness of one hand or one leg or anything, your child is not having any what we call children with chorea, the hand is always shaking, all those kind of things. If your child is not having any of those kind of movement issues or posture issues, if your child doesn't have cerebral palsy, because I see a lot of people saying that as well, that, oh, my child has cerebral palsy. No, your child doesn't have cerebral palsy. So your child must have that one first before we say cerebral palsy. And if your child doesn't have repetitive behavior and social interaction difficulties, that child doesn't likely have autism. So that is different between autism and cerebral palsy. Of course, there are some things that will overlap. So both children can be developmentally delayed. Both of them may be slow talking. Both of them may not be potty trained on time. Both of them may have all those ones, but those ones are the secondary features. The core features must always be present before we give a diagnosis. But again, remember, a child with cerebral palsy can actually have autism as well. A child with Down syndrome can have cerebral palsy. No, a child with Down syndrome can have autism, not cerebral palsy. So that is just that's what makes it more confusing. But like I said, don't do the labeling. Don't let the professional tell you what is wrong. And usually when we make our diagnosis, we make a whole long list. We make a long list and say, the child with cerebral palsy is the main diagnosis, but the child also has global developmental delay. Maybe the child also has hearing impairment. Maybe the child also has visual impairment. Sometimes our diagnosis is about 10 lines long, depending on all the other features, because we have to clearly write it out so that we know what are the issues that we need to address in that child. I hope that's helpful. Okay, so this is another question, ADHD and autism. So ADHD and autism are also not the same thing. So ADHD, for those who don't know, means attention deficit hyperactivity disorder. So children with ADHD, they're always very fidgety, they're always on the move, always on the go, or they don't pay attention, they're always losing their stuff, they're always forgetting they ask them to do one thing, they're forgetting, they're always chatty, impulsive, and all that. So that is ADHD. Most of the time they don't have problem with social interaction. Most of the time they don't have repetitive behavior. So children with autism sometimes can also be hyper, that they are busy they can be pacing back and forth, which is a repetitive behavior. Not because for children with ADHD, they can be going up and down busy, but it's not because they will keep going around in circle or spinning, which is what a child on the autism spectrum will do. But a child with ADHD will also not sit down, but it will not do it repetitively like that. We may just go from this place, then move to another place, then move to another place, So the way to differentiate them, the way to differentiate the hyperactivity of autism from that of ADHD, and also, like I said, autism must have those social difficulties. Children with ADHD they talk to anybody, they are impulsive, they just blot out everything. So they are like that. So and they will talk, they will go to everybody. They usually have too many friends, but they lose them because they are most of them cannot cope with them, you know. But children with autism will not even want to talk to anybody. Sometimes they just in their own corner, they're not talking to anybody and all that. So, but again, a child with autism can also have ADHD. So sometimes the two can coexist together, but they're actually two separate conditions. But again, ADHD can be what we call a comorbid condition, like it's an extra condition in a child who is on the autism spectrum. So that's how it can become complex. But there are two separate disorder with separate diagnostic criteria. All right. So ADHD is not a sign of autism. ADHD is a diagnosis on its own. Autism is a diagnosis on its own, but the two can happen together in the same child. But there's a way we differentiate it. All right. Somebody say my 7 weeks had rashes. It's reddish. Okay, if your child has a rash, we need to see it. It's either you put a picture of it on our Facebook group, or you go to a doctor who will see your child and make a diagnosis. Without seeing rashes, we cannot diagnose them because we won't know which of the rashes we're dealing with. All right, somebody said my 18-month-old hasn't started walking. Okay, I've taken her to see a pediatrician. She recommend calcium and completed dosage. Okay, so when a child is not walking, it is not calcium. This is another thing Nigerian mothers especially like to do a lot. Everything is not about bone. So when it comes to development, it is the brain. So it is not the bone. So giving calcium is a waste of time because calcium is not why your child is not walking. Bone is not the reason why your child is not walking. It is the brain. Okay. Development has to do with the brain. All those disorders that was talking about, ADHD, autism, cerebral palsy, it has to do with brain, not the bone, not the hands, not the leg. And that is why I say sometimes it depends which professional you see. When it comes to developmental issues, please see the right professionals. So a pediatrician who is giving you calcium for a child who is not working at 18 months, I doubt the person is a pediatrician. I don't think, again, the word pediatrician is always used loosely. Anytime people see a doctor because they have seen a doctor because it's a child, they are taken to that doctor, they assume that doctor is a pediatrician. It doesn't mean the doctor is a pediatrician because an average pediatrician will know that a child who is not walking has a developmental delay, and that pediatrician will either see the child or refer to the developmental pediatrician or pediatric neurologist, who are the super experts when it comes to children with developmental disorders. So this 18-month-old who is not walking needs to see a developmental pediatrician. We need to see the child. We need to know why the child is not walking, because that child is delayed. So is it cerebral palsy, or is it what we call global developmental delay? Is this something else? We need to know. So we need to see this child. You need to take this child. Preferably take this child to a teaching hospital. Why I always recommend teaching hospitals? Because teaching hospitals tend to have these super specialists. So they will not just have pediatricians who are general pediatricians. They will have pediatricians who have their own area of specialty. So developmental pediatrics, for example, is a subspecialty of pediatrics. So we see the children with physical or developmental difficulties, mental difficulties. That's our job. So then you have those who see children with respiratory problem. You have those who see children with cardiac pediatric cardiologists who see children with the heart problem. So sometimes your chances of seeing the right specialist or super specialist, if you want to call it that way, is higher in a tertiary level hospital than in the lower level hospital. So my 18-month-old who is not working does not need to take any calcium. That child needs to have a proper assessment. Okay, the next person said, Doctor, well done, man. Thank you. Some autistic children are also blind. Autism does not cause blindness, okay? If the child is blind, I don't know why the child is blind, but I don't want to make I don't want you to make that connection. There's nothing about autism and blindness at all. So it's just like anybody else can be blind. Anybody can be blind. That is that something to do with the autism. A person who doesn't have autism can also be blind. So the same thing that happens to people that don't have autism can also happen to people that have autism. So the same way people that don't have autism can be blind normally, children on autism can be blind, but it has nothing to do with their autism. So that is number one. Then number two, if a child is blind, a child that in a Nigerian setting is suspected to have autism is blind, I'm more likely going to suspect a child maybe who has cerebral palsy rather than a child who is having autism. But because this time around, when people say autism, I'm not sure you are using autism correctly, because I'm not sure this child was assessed and diagnosed with autism, or that autism is a label those of you around have assumed with that child. Because the only developmental condition that tends to happen with other blindness and hearing loss and all those is cerebral palsy. So I really want this child to be seen by a pediatrician, developmental pediatrician, to have proper assessment. And then what can make a parent to have three autistic children? It's possible to have autistic, it's possible because autism can be genetic. So it's possible for all the members of the family to be autistic. So that's not the issue. But in this case, because of my background and because of my knowledge of what happens in the Nigeria setting, I always want to know whether these children were actually diagnosed with autism or this is just an assumption you are making. And if you say the children were diagnosed with autism, I want to know who does the diagnosis, because sometimes some other professionals may not be able to actually make the diagnosis of autism as well. So when people tell me autistic, I'm kind of skeptical. So I always want to know. So because we need to be sure, so that if not, we will be carried away and other. In other places, you will never say you are autism. You never say you have autism unless you have a assessment and a diagnosis by the right professionals. They give you your reports, then you will say, but in Nigeria, I know people use those things a lot loosely who have not had any formal assessment, and it's a very dangerous thing to do, really, because you can actually mislead the professionals. So, especially for this child that is having what look like autism with blindness, I'm actually worried that is autism the right diagnosis here, unless the blindness is just on its own. So we need to be sure. So if you have more information for me, you can always talked about it. So somebody said, good evening, what can be for a 2-month-old with serious acid reflux? So who made the diagnosis of acid reflux? Because if somebody made a diagnosis of acid reflux, I expect that same person would have told you what to do. Don't make self-diagnosis, okay? If your child just have reflux, you don't need to do anything. You don't need to give anything. Breastfeed the baby, keep the baby upright 15 to 30 minutes after feeding before you put them flat. But if you've seen if it's really bad and you've seen a professional and the professional make a diagnosis of acid reflux, that same professional will tell you what to do. So, but I always want to be careful not to take diagnosis label from parents, because you will give the wrong advice and it can be dangerous. Okay, somebody is asking what are the symptoms of autism in infants. So I guess you are new to the broadcast now, so no problem. At the beginning, we've talked about what are the symptoms. I want you to, after we finish now in another few minutes, can you just watch the video all over again, because I have it there and actually even put them on the screen for those watching on YouTube and Facebook. So you can just watch the video again so that we don't repeat and answer all the remaining question. Okay, I think we've answered the question about reflux. And good evening. What can be so neighbor? Okay, what is this person waiting for? This person is really desperate. You don't need to use anything. Just keep your baby upright after feeding and make sure that the baby stays straight for at least 15 to 30 minutes before you put them flat. That's all. Reflux is a common thing in babies and it's nothing to worry about. Okay, I think I've answered all the questions. I just want to check whether there's any still left on Instagram so that I can okay, I think I know where I stop on Instagram. I still have like 2 questions. So at what month will a parent know a child has autism? Your parents will only know each other as autism when we've given you the diagnosis of autism, but parents can start suspecting features of autism right from age of 6 months. I've seen some of my parents who will tell me, I know there's something wrong right from 3-4 months. Some parents are that good, and that's because some of them have had children with autism before. So if you have had other children, it's easy for you to know when something is wrong, because you will compare. So if your child at 6 months does not have, let me just quickly go through let me just go through it again, since many more people are asking me now. Let me just show you the features again. So if a 6-month-old does not have smile, it's not giving you social smile, it's not smile. When I say social smile, it is not the smile baby smile in their sleep. That is not smiling. Okay, smiling is the child looks at you, you smile to the child, and the child gives you a smile back. That is what we call social smile. So it's a back and forth between you. The child looks at you, recognizes you, smile at you smile at baby, baby smile back. It's not that baby is sleeping and smiling. That is not social smile, and that is not the kind of smile. Or the child is having no high contact, so the child is always just looking away. The child doesn't want to look at people. The child is not recognizing people. Child is not babbling by 12-month-old. No word. The child is not pointing. It's not waving goodbye. It's not responding to you or her name. As early as 7 months old, baby can respond to their name. You call their name the tone. So if a 1-year-old is not responding to their name, you call them, they are not responding to their name. But when they hear the listless sound of the Peppa Pig or Coco Melon, even if they are in the farthest room in the house, they will come to the living room. So that shows that the child can hear. But you call their name, standing behind them, they will not turn. So that is lack of response to name. Then there's a problem. They have speech delay. If they are saying things before and they stop saying them, then there's a problem. If they always isolated, they don't do pretend play. There are lots of features, but we can't go into all those details now. So you should take those kind of children. If they are doing repetitive behavior, they are very engrossed in certain things. They only want, they throw a lot of tantrums and all the stuff. They only want to do things in a particular way. They only want to eat a particular food. And they are very fussy. They block their ears to sounds. All those repetitive. They're always spinning, rocking, flapping. Flapping is when they join. There's a lovely video on Facebook that I shared to some of our groups that actually show you all these features, how the children do them, tiptoeing, they're always going on their tiptoes and all that. When you begin to see a lot of these features, in a child who is also having speech delay, a child who is not responding to their name, a child who is not interacting with other children, who is always isolated, then you know that there are red flags. And then you can do some screening online. You can do the MChat yourself online, or you can just go see your pediatrician, and then they can refer the child for autism assessment. All right. It's also part of what we should be checking when you come for your regular checkup with us at the for your immunization, for everything. That is why anytime you see a pediatrician, we always ask about your child's development. We always ask. I know you do. You always wonder what has cough got to do with it. Is your child sitting, your child crawling, is your child talking? But we are actually stylishly trying to also check your child's developmental milestones as well. That's why we always ask those questions. Final question: what month should we be worried about developmental delay? So today is actually not about developmental delay, it's about autism, but I'll just quickly give you a quick some quick what will I say, like things you can use to check your child development. So usually neck control should be 3 months old. So when we talk about developmental delay, we talk about development in different areas. So we have of course the motor, gross motor, that has to do with walking, running, jumping. Fine motor has to do with the hands. Then language is and communication. That's about speech. And then we also talk about social interaction and all that. So those are the 4 main areas. Sometimes we can split them up to 5 or 6. We also have the hearing. We also have the vision. So they are all developmental milestones. So in terms of the motor skills, we want your child to have neck control by 3 months, maximum 4 months. We want them to be sitting by 6 months with support. We want them to be sitting without support by 8 months. Crawling, if they are going to crawl, some children never crawl. If they are going to crawl by 9 months, 10 months, we want them standing by 11 months and moving around table by 11 months, and we want them walking by 1 year. We want them running 18 months, jumping 2 years and all that. So if your child is slow in doing all of those things, so let's say the way we normally do is that if by the time your child is supposed to be doing a particular milestone and the child is not even doing the one before that one, then we will worry. So for example, your child is supposed to be sitting with 1 year. Your child is not 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 sitting by 6 months with support. If your child is not yet having neck control by 6 months, then I'm worried, because this child is supposed to have moved to the next level, but the child is not yet even doing what is before that level, then I will worry. So if you see your child not doing, and parents are very good at speaking of developmental delay, because you will compare your child to all the other children that are born at the same time, to all the other children that are born in the family, or in your church, or in your mosque, or everywhere you go, your friends' children that were born at the same time, maybe 1 week, 2 weeks different. So you can always say, oh, this person's child is doing this thing. Of course, some children are faster than the others, but if they are like significant delay, so a child doesn't have their control at 6 months, a child is not sitting at 8 months, a child is not yet walking by 18 months, that is when I will worry about your children. If your child does not have any single word at 1 year, your child does not have 2 words at 2 years, your child does not have sentences at 3 years, your child is not speaking at all at 4 years, I will worry about that child. Then you need to see us. Or the child is still, by the time they're about 3 years, they're still not yet potty trained and all that, then we'll begin to worry. So those are just a few things. If you want the full list, you go to our website, www.askthepediatricians.com, and then you can look at the is your child's development delayed, and also have it on my podcast. Just check for Ask Dr. Gbemi ATP on any of those podcast platforms. Let's say one on child development, so you know when your child is developmentally delayed. You can have the full list. Because of time now, because I'm also just talking about autism today, I don't want to go into that, because it's a full session on its own talking about developmental delay. All right, I think I'm done for today, and our time is up. Thank you so much for watching. Again, today we've talked about autism. It is the World Autism Awareness Month and week and day on Tuesday, and today that's what we talk about, autism. So if you suspect your child has autism, please see your pediatrician. And please ask your pediatrician to refer you for autism assessment. And I plead with my pediatrician colleagues and doctors, please don't reassure parents that there's nothing wrong. And I see that all the time, because I've seen children being diagnosed at 8 years and 9 years, and the mothers were like, I've been going to the hospital since my child was 1 year or 2 years. I've been asking the pediatrician, I've been asking the doctors, and they just told me, oh, my child is just being slow. Your child will talk. If your pediatrician tells you that, please seek a second opinion. Okay, nobody should reassure you without doing a proper assessment. So you should make sure your child is properly assessed, and the earlier, the better. The earlier, the better. And it's better the child have what we call early intervention, because it will lead to better outcome. So thank you so much, everyone, for those who have been watching. And this program has been brought to you by Ask the Pediatricians Foundation, and our vision is to reduce all the unnecessary deaths of children in Nigeria, in Africa, and even the entire world that are preventable. So you can, if you still have questions, please go to our Facebook group. We have like 4 Facebook groups now. We have the one for Ask the Pediatrician, that's the major one. We have the ATP family for adult questions, and we have the ATP still a mom for those who have suffered miscarriages or child losses, and we have the first time mom baby care ready group as well for first time mothers. So you can join any of our groups or all of them, and you can post your questions on those groups from Mondays to Saturdays, 24 hours every day. And our professionals, with support of our admin moderators, will try and answer your questions. If you want to do private one-to-one chats or consultation with our professionals, you can also do that, but that is not free. It is free to post on our Facebook group. It is free to ask your questions there. But if you want a private one-to-one or chat or consultation, you can send us a WhatsApp message, or you can send us an email, and we can arrange that for you. You have to pay a token for that. And if you want to listen to all the previous videos, it's available on Instagram TV channel, IGTV. It's available on our Facebook pages. It's available on our YouTube. Our YouTube is ACP TV, so you can always watch all our videos again, and you can learn a lot. And we also do community outreaches, and in fact, in May, we are going to do community outreaches in all the states and of Nigeria. And so you are welcome to support us. You can donate to our bank account. You can donate on our global giving page on our website. And of course, you can also volunteer for us, either as non-medical people or medical professionals. And for first-time mothers, if you want to join our first-time moms group, it's available. It's a 12-week 12-week WhatsApp coaching with myself for first-time mothers. We talk about everything you need to know: breastfeeding, complementary feeding, newborn care, sick newborn, everything you need to know. I recommend it for you. And you can just also send us a message on our WhatsApp group. It's 20,000 naira only for 12 weeks. And I think we're in week 6 now. So, but you're welcome to join us. You can still watch all the past videos. So thank you so much, everyone, for watching ATP Live, and I'll see you again next week. Thank you. Bye.
Can I